Welcome to Entrepreneurs in Healthcare. I've come to realize that entrepreneurship discussions are long overdue in medicine. I'm pairing up with voices from healthcare that value entrepreneurship and that are willing to come on the screen with me and hold a discussion. I'm hoping that hosting these conversations will open up pathways to making progress in medicine and not making entrepreneurship a bad word. Join along on this series as we dissect entrepreneurship, healthcare, and everything in between. Hi, everyone, and welcome back to our series, Entrepreneurs in Healthcare with Dr. Corriel. I'm Donna Corriel. I'm an internist turned digital entrepreneur, and I am so excited to be recording yet another episode. This time it's with Dr. Shelly Latte-Naor, who I am going to have introduce herself in just a second, and just let you know that we're going to come back in just a moment to the question of the hour, which hopefully all of you already know what it is. So, Dr. Latte-Naor, welcome to the show, and please introduce yourself.
Hi, Dana. Thank you for having me. So I'm an internist. I am fellowship trained in integrative medicine, and I've been part of the Memorial Sloan Kettering Cancer Center faculty and service there. So I've been practicing 100% integrative medicine over the last 8 years, mainly with the cancer population and survivorship population. And so I feel a little bit like an imposter being on an entrepreneurship podcast, just because I'm very much a clinician. I have been all the way, after training all the way at academic institutions. I have not spent a second of my thinking about things like marketing, entity formation, revenue, things like that. And now I am on the verge of stepping out of that into entrepreneurship, at least sort of baby entrepreneurship, opening a micro practice. And so, it's a new world.
Wonderful. I think that we probably all will know what your answer is to this question, but given the show, we always open with the question of, is entrepreneurship in healthcare good or bad?
I think it's very important. I think it's very important for us to take back a little bit of that agency over how medicine is being offered to patients. Don't get me wrong. I've been part of an amazing institution that I've been honored to be part of, and that I've grown so much under, and have been inspired so deeply by. But at the same time, I think that the structures of corporate medicine sometimes become very robotic and very they're very far away from what actually happens when we sit together across the room, across the table from our patients. And it's so far removed that sometimes it doesn't make sense. It doesn't make sense. And we see that, how industry is offering care. We see that innovation happens so much faster in some of the medicine startups, answering some of these unmet needs. And so I think that for us to take agency back is going to be essential, not only for us and for our well-being and for, burnout, we all know is basically a pandemic. Um, it's also for our patients, also for our patients. I realize, stepping out of academic medicine into private practice will limit access in many ways. And I'll have to be creative to try and expand access. And I'm ready to take on the challenge to have more agency for myself in how I practice medicine and how I live my life as well. Right.
So I want to just quickly comment on the way that you worded that. I just want everyone listening to note how respectfully you said that. I really laud you for that because, you know, doctors stepping away from these corporate structures, it's not a bad thing, right? We're doing it with respect to them still being spaces that, for example, we still need, right? Like hospitals, we will still need hospitals. So I don't think that doctors like you are stepping away and wanting to be on bad terms with a hospital where your patients, all of us will end up in a hospital probably one day or other because we all age and things happen. But I really like that respect factor that you just gave a nod to them and said, I do respect you and I do so appreciate that you took me in while I worked for you. Do you think that there's an amicable way that we can slowly evolve into breaking away from corporate structures, or do you think it's going to get ugly before it gets nice?
Good question. Um, I don't know if amicable would be the right term. I think we're really offering a different service altogether, right? I think that in the confines of corporate medicine, we're going to see, and we're seeing really a lot shorter visits. We're seeing much of the care being delivered by wonderful, knowledgeable APPs, but it's still a different service than consulting with a medical specialist. So I think it's just a different offering, and so I don't know if amicable is the right way, but I think we're going to exist in parallel until we can we can come together at some point in the future, hopefully.
Absolutely. Here, here. I think that, I've just been in entrepreneurship for so many years. Like entrepreneurship has been on my mind for so many years, even while I practice medicine for a corporate structure, that I just like, I understand like the entrepreneurial mindset that exists behind the scenes of actually operating these structures. And so
Mhm.
I envision, and I think most people listening would agree, no matter what side you're on, but I envision that um, it's not necessarily something that corporate structures are liking, meaning a lot of
Mhm.
respect to them, but I don't
Mhm.
think that they're like out throwing a party for us that we are breaking apart and kind of forming our own structures to be
Mhm.
seen privately. I think that it offers them it builds competition for them. I worry a little bit that the corporate structures are going to flex their muscles and in
Mhm.
different ways. And so again, this is something that entrepreneurs like you and I and the rest of the doctors out there that are breaking apart to kind of form their own thing, we have to probably face.
Mhm.
Is there anything that you are worried about from that perspective, or do you think like it's going to fall into place?
I think that people are so diverse in what kind of care they seek and what kind of care they need, right? We all have different sort of archetypes that we're looking for when we're looking for a physician. I have a different archetype for an internist, different archetype for sort of the OBGYN that I want to see, right? We all resonate with different care models. And so I want to believe that there is space for everyone, but I do see that the academic institutions, the large hospital systems, they're going to have to compete with some of the things we're offering, and they're definitely going to flex their muscles in that. And so I don't know that in a corporate structure, you can be as nimble, as responsive, as personalized as when I'm sitting across my patient. So I'm not as threatened by that. But I do see what you mean. I do see what you mean. At this point of my journey, I'm not yet. I'm probably naive, but I'm not yet concerned about it. But yeah, um, let's see.
Absolutely. Absolutely. And you touched on something that's so very important, and that's that the patient is going to get more of Dr. Shelly Latte-Naor when she's private as opposed to when she's part of this corporate giant that's making the rules for her. So again,
Mhm.
you're respectfully leaving, but you're trying to build better. And I respect doctors that are trying at least to say it's not working right now as is, and I'm going to be, entering the fight to really try to redefine how to do this the right way. And it's especially heartening for me when I see really nice and sweet doctors like yourself. And again, you're an oncologist, and so that's who the field actually attracts, are very sweet and nice and warm and compassionate people. From I know that it's a stereotype, but that's at least the way that I've seen it. Because obviously, patients that are grappling with cancer need that attention and care and warmth.
Mm. Yeah, just a correction. I'm not an oncologist. I
Oh,
just have been practicing integrative medicine in the oncology field.
yes. Okay. So
Mm.
I guess we didn't get to that part in the introduction. So tell us about how you practice. And let me just tell the audience why I said oncologist. I made a mistake, is because Dr. Shelly Latte-Naor is joining our speaker lineup for an upcoming conference called Empowering Women in the Face of Cancer, Navigating That Journey, which is really front facing. It's there for anybody that's facing a new diagnosis of cancer, or their caretakers, or any doctors that have patients that could use this as a resource. So tell us very quickly about your career and your field and what you're practicing.
Mhm. Yeah, so I'm an internist. I just did internal medicine residency followed by actually an infectious disease fellowship. So I'm trained in ward and infectious diseases, but I haven't been practicing it outside of a small little stint in during the pandemic. But I went into integrative medicine fellowship more out of an urge um, to serve my patients better. So at the time when I made the decision, I was still practicing internal medicine mainly, but also had my small HIV primary care panel in a very underserved population. I had a mentor that was practicing integrative medicine, and I saw that the approaches she took just gave her so much more access into a patient population, buy-in with her patient population. And in the closet, I was a yogi since my early 20s, and it was sort of a way to bring together some of what was happening in my private life and medicine. And so I did the integrative medicine fellowship at the University of Arizona Integrative Medicine Center, now the Andrew Weil Center for Integrative Medicine. And and after that, I was left with the question: so how do I actually practice that in an evidence-based context? What does that look like, right? What does that look like in practice? And so I did an observership at one of the oldest integrative medicine centers in the country, which is at MSK. At the MSK has now for over 25 years an integrative medicine service that is very research heavy, that is really aiming to bring an evidence-based approach or evidence-based use of these complementary and non-conventional methods into the standard of cancer care, supportive care. And so I got to observe there, and they had an opening, and the rest is history. And so I've been there for the last 8 years, and so it has been a really interesting path. And a path of a lot of growth and a lot of questions. And I think there's a lot to say about the field of integrative medicine. I think it's a not very much defined field, and so a lot of different things are happening under an integrative medicine shingle, right? And some are more aligned with what we think of as evidence-based practice, and some less so. And so navigating that fine line has been a really interesting path to take over the last 8 years.
Amazing. Thank you for sharing your journey with us. You know, sometimes I hear the question asked, how is integrative medicine different than lifestyle medicine?
Mhm.
Do you have an answer for that?
Yeah, so I think there's a lot of overlap. Let me say that. So I think there's a lot of overlap. We have lifestyle medicine as part of integrative medicine training, and that there's a lot of effort and time being spent thinking about nutrition, and exercise and sleep and stress management, which are all parts of lifestyle medicine, and for which there is a lot of evidence. Integrative medicine, in addition to that, also occupies itself with the use of traditional medicine, herbal treatments, traditional Chinese medicine, other healing modalities, acupuncture, is often used, as part of integrative medicine, Ayurveda, and other sort of schools of healing. So these are also being considered as another tool in the toolbox in integrative medicine. And I think that is not part of lifestyle medicine. So that's what I would say is the difference, right? It's a little bit more expanded. I
I
think that it is.
understand. Okay. And now back to the whole entrepreneurship thing and specific to your journey, what
Mhm.
specific part of your journey are you actually in? Like, do you have a physical practice that you are opening and that you can identify and address to? Are you still just kind of breaking off and kind of formulating next steps? Like, where are you in your journey? We'll be right back. SoMeDocs is building a conference called Empowering Women in the Face of Cancer, Navigating the Path Forward. Take a listen to some of our speakers.
I'll be speaking about menopause and cancer and how do we help women navigate the collateral damages of breast cancer treatment, which often includes premature menopause, surgical menopause, or menopause due to her treatments.
I'm really excited to share with you about what psycho-oncology is. Essentially, in a nutshell, it's mental health and cancer care.
We will begin by discussing the role of nutrition and what impact it can have on your health after cancer. Then we'll review the healthy eating recommendations for cancer thrivers, and we're going to discuss some specific dietary patterns and types of foods that can help optimize your health after cancer. Then we will have a cooking demonstration to show you how to prepare a few tasty and versatile recipes that use foods that nourish you.
I will be sharing with you the latest information on using your own immune system in treating cancer. Between lifestyle interventions and strengthening your immune system, there is so much that you can do to help heal from and prevent recurrence of cancer.
My talk will cover some of the basics of clinical trial design and how drugs move through the approval process. I'll also speak to some of the recent drug approvals in breast cancer and how they're advancing the needle in our care for our patients.
I'll teach you about how you can advocate for yourself, how you can gain interdisciplinary support, and how you can find a sacred space that you can feel comfortable and seen and validated, and learn to figure out how to prioritize what's the most important part of your life right in this moment.
The panel will be comprised of members from patient navigation, financial counseling, and social work. Financial toxicity will be explained, as well as the roles of each of these teams in helping to reduce the financial burden patients and caregivers face.
Real life lessons to reestablish intimacy with one yourself and to your partner. I'll give you some tips and tricks of how to talk, how to relate, and let's just make that part of your life more comfortable.
I look forward to speaking with you about radiation in general, how not to fear it, and how it's an effective tool in treating cancers.
You can catch this event live and watch all of our lectures for free, May 13th through 18th, 2024. Otherwise, access the footage on our website at doctorsonsocialmedia.com/conferences. You can catch this event live and watch all of our lectures for free, May 13th through 18th, 2024. Otherwise, access the footage on our website at doctorsonsocialmedia.com/conferences. Now back to the show. What specific part of your journey are you actually in? Like, do you have a physical practice that you are opening and that you can identify and address to? Are you still just kind of breaking off and kind of formulating next steps? Like, where are you in your journey?
Mhm. Yeah, so I'm going to be sharing space with an established integrative medicine, women's health physician here in New York City. And I'm going to be my own entity, but we're going to be collaborating and sort of enjoying each other's expertise, differing expertise and presence. And so I think that that's going to be the next step.
Wonderful. Oh, that's great. So you will be sharing space with her, which, obviously offsets some of that cost, especially when we're talking about New York City. It's so
With
very,
him, yes, and
oh, with
he's
him.
also, an amazing mentor because he's been in this space for so long, and
Oh, is that right? He's a private
yeah,
entity already
yes,
and
yes,
practicing medicine on his own. Do
yeah.
you think that it's going to be easier to break. I mean, in some ways, I'm thinking it could be easier. And in some ways, I'm thinking it could be harder when you're located in New York City, right? Because on one hand, there's a wealthy population in New York City that maybe could afford, seeing a doctor privately, even though when you actually do the math, sometimes it's not necessarily any more expensive than when we're using insurance, but that's for a different time. Versus that you're up against, again, so many top universities and behemoth health systems. I guess you're kind of planning on figuring out exactly how you fit in how you fit in.
Yeah. I think the density here plays more in our favor, I would think. Um, uh, there's just not only density in health, in hospitals and all kinds of different physicians that are practicing in New York City, but there's also a density of the population and with their diverse needs. Um, so I think it cuts both ways, probably. There's competition, but there's also so many more people that are available seeking care.
Absolutely. Now, are you going to specifically see women that are diagnosed with cancer, or are you seeing anybody as an internist?
I'm going to be seeing anybody, although over the past years, my practice has evolved to serve primarily a female patient population in midlife. Many of my patients were patients with breast cancer or after breast cancer and gynecological cancers having some kind of menopausal phenomena, either surgical, treatment related, or natural in survivorship. And so that has evolved to be my practice. And so I'm going to be seeing women in midlife with and without cancer.
I mean, this is probably a moot point and a rhetorical question, but do you think that women are particularly drawn to you just because you're a woman and that warmth that you exude?
I think so. I think so. I think that there's a bi-directional draw, right? Just because you identify with somebody that shares a lot of life experience and knows that they're gonna get you, right? So I feel the same way. And I'm seeking care, and I figure it's the same thing for my patients. Yeah, uh, probably.
I feel like, I've been so active on social media for the last few years, and I'm very aware of the gripes that both doctors have and that patients have as well. And I've really definitely um, been attuned to patient gripes about not being listened to, maybe specifically even more coming from women that suffer in silence with all kinds of afflictions and disease states, and they're just not listened to. Is that something that you believe that being an entrepreneur can directly or indirectly solve?
If you your own needs, if you feel like you have to compromise on your own health and the needs of your family, it's very difficult to deliver exceptional care, especially when we're talking about things like lifestyle medicine, right? So if you are subjected to a schedule that doesn't work for you, if you are have to compromise on your values in delivering care, it's going to be very, you're going to be pouring out of a not full cup. And so I do think that honoring your own needs is going to be essential, and especially delivering this more whole person approach to care that is usually less transactional, right? It's very important. So yes, I do think that's absolutely true.
Well, I'm going to just mention here the dates of that Empowering Women in the Face of Cancer conference, also because it is free while it's live. And so the dates do matter from that perspective. It's May 13th to the 18th of 2024. But if you either cannot be there or just want longer access, you can certainly purchase a VIP ticket. So I want to be sure that those of you listening who still have time can come and join us it's not in person, but it's live and it is virtual. And then moving on to that entrepreneurial side and knowing that you're breaking off with your long-term, partner and establishing a private practice of your own, we do have a private practice conference, which is coming up also May 31st through June 2nd of 2024. Same thing. Yeah. So it's a live event. We've decided Dr. Laura Hockman is chairing that, and we've decided to make it free while it's live so that any doctor that wants to come and wants to, either break free from their system, and basically really targeting the beginners of private practice, because we want to then hold a second one possibly where it's like for a bit more of the intermediate level private practice owners. So Dr. Latte-Naor is welcome to join, but also anybody that's listening that has an entrepreneurial mindset and just kind of either is ready to take that next step or wants to explore, those options. That's coming.
I'm going to be there.
Awesome. I love it. I can't wait to see you virtually. I mean, we do have we do constantly think of ways to innovate and to, for example, create a way to interact with conference goers, because to me, the whole draw to an in-person conference is the networking. A lot of us really love the networking, and sometimes that's lost from a virtual conference, but it's very important for me to add that networking component and that interaction to any conference that I help to organize and lead. So shifting over really quickly about going out on your own and about marketing, are you at all starting to think about that really scary and formidable concept of marketing? We'll be right back. SoMeDocs is building a conference called Empowering Women in the Face of Cancer, Navigating the Path Forward. Take a listen to some of our speakers.
In this lecture, I plan to help you with Oncology 101. I will be discussing the different types of tumors, different types of treatments, staging systems, as well as how to organize yourself.
In my talk, I will discuss what the latest research is on the Disabilities Act, as well as what protections you have for your career, and why you may want to work, and say that out loud and share that with others.
For many patients, it becomes a really difficult landscape to navigate because there's just so much conflicting and contradictory information out there about all things non-conventional and holistic approaches.
I look forward to providing you with what I didn't have and what I wish I would have had when my family member was battling cancer.
I'm excited to bring my years of experience to this forum where we'll get an opportunity to talk about how to empower women with cancer diagnoses through a mental health lens. What we know from research is women that do focus on their mental health priorities and make it a priority during their cancer treatment tend to have better health outcomes.
I work with people who have trauma and triggers, pretty much negative life events that seem to show up when they're not invited. I look forward to sharing with you how you can address these triggers and these memories and integrate them so that your body no longer has to try to protect you and remind you of these difficult moments you've been through, but so that you can process them and release them and go forward in a different way.
I'm Dr. Sunny Miles, and I practice palliative and integrative medicine. I'm passionate about helping people navigate these challenges, helping people feel more resilient, and helping people identify and live what matters most to them, even while they're going through treatment.
It's crucial to discern between inherited and sporadic cancer, to understand what cancers can be inherited, what is a mutation, what is genetic testing, and to separate fact from fiction, especially in the day of social media.
In this presentation, I'll be drawing on my years of clinical experience as an art therapist, working bedside at Memorial Sloan Kettering Cancer Center with female oncology patients and their families, caregivers, and providers, and explore the many ways that art can help heal and empower patients, reinstill a sense of hope, calm, and mastery, and eventually lead to better patient outcomes.
You can catch this event live and watch all of our lectures for free, May 13th through 18th, 2024. Otherwise, access the footage on our website at doctorsonsocialmedia.com/conferences. Now back to the show. Are you at all starting to think about that really scary and formidable concept of marketing?
I'm mainly listening to a lot of people who've done it. There's also a lot of podcasts where people sort of offer their advice and their first steps. And I've been somebody who's been very private, not engaging a lot on social media. So I'm sort of that probably typical introverted physician. Um, uh, I think I might have to take that on. Um, A and B, I think that I also will have to, we talked about networking and the value of networking. I think that's also going to be extremely important.
It is. It is. And again, I don't want to like single out your employer because it has nothing to do with your specific employer. I'm just going to make a general statement that the problem that we're facing as physicians nowadays, especially those that are trying to break free and kind of form private practices of their own, is just that those behemoth health systems sort of have their own networks established. And it's a very complex web that is very hard to break. And again, this is where networking, I think, will hopefully be some form of solution for us, where we can kind of form our own web, like in a good way, in a way of, there should be freedoms to refer to a consultant that you truly believe is the right consultant, and not just because they're part of the health system and you're expected to refer within that system. I think keeping the patients in mind, I think should be number one for physicians. I'm sure that you agree with it, but what are your thoughts?
Yeah, absolutely. I think that when we can have these networks be more personal, where we really know someone, we know their expertise, we know the perfect patient. Um, it's all about really that personal connection, both to your patient and to your network, in order to make a informed and personalized referral, matching people to their needs, to their specialties. I think a lot of people, like myself, we have a niche. A lot of us are going out into private practice because we feel we want to honor that niche. We want to expand. We want to really offer a excellence in that niche. And so having that network is going to allow me to deliver better care, because I can match patients with with the providers that are meeting those needs, as perfectly as possible. Yeah.
Amazing. Amazing. And again, I hear to that because, we're all going to be patients at one point or another in our lives, and most of us at least. And um, it's nice to know that the person who's treating you really has your best interest at heart, and less so sort of the system telling them what to do. So kudos to you for taking that step and for believing in yourself enough to kind of break free and say, I'm going to do this on my own, and try to really kind of connect with the patients that see what I bring to the table, and believe in me. So I wish you luck in your future endeavor. I also am excited to hear you speak in the conference. And again, just to reiterate, you can still, purchase access to the event after you listen to this, even if it's after the live event. Can you tell us about your specific lecture and what you're going to be teaching?
Yeah. So I think that if your listeners are mainly physicians and other providers, many of you take care of cancer patients. And if we look at some of the statistics on the use of complementary and even alternative medicine, cancer patients are up there, right? So the use is anywhere between 60 and 80% across a cancer journey. And much of that use is unsupervised. So many patients that are using, for example, herbal extracts or other non conventional modalities are not going to tell you about it, and they're often informed by diffusion, right, by marketing in the community, rather than guided by a healthcare provider. And so we're going to walk through what the value is of having competent, evidence-supported, non-conventional integrative care be accessible to patients in the cancer journey, both for establishing a safe use of these practices. We know they're using these things, but how can we ensure a safe use And also, how can they benefit? How can they answer your needs of symptoms that you may not have enough tools to address, where conventional methods may not be often as satisfying or effective for patients?
Wonderful. All right. I look forward to that, and I look forward to every, speaker topic, because it's just such a rich, diverse variety of lectures that are going to be presented. So thank you to you for both being a part of the conference and for hopping on to this episode. Anything you want to leave the audience with, maybe like an ask that you have?
An ask. My ask would be for us all, more an encouragement to myself and to my colleagues that are like myself, to just join forces. I think that we all can gain so much by putting our heads together.
Awesome. Love that. Really an encouraging message and an optimistic one as well. So thank you for joining. And I hope that you enjoyed this episode. If you did, please consider sharing it. We would really appreciate it, so that hopefully more doctors that are thinking about, going out on their own can sort of maybe get some inspiration from Dr. Latte-Naor. Thanks again.
Thank you so much for having me, Dana. I really enjoyed our conversation.
Sure.
Thanks so much for listening.